Today, we're talking about wet to dry dressings. Yes, they're still being used. By the end of this video, you'll know exactly when they cause more harm than good and what to do instead. You walk into a room and see a wound packed with wet gauze. You pause and you hesitate and think, wait, are we still doing this? Here's the truth. Wet to dry might feel familiar, but it often does more damage than people realize. Let's talk about when it's okay and when it's time to move on. For those who don't know me, my name is Dr. Voltaire, and I've seen the full spectrum, from pristine surgical wounds to the absolute messiest chronic cases. And wet to dry dressings, more often than not, they're left behind like an old habit, one that no longer fits. If you're just stepping into wound care, or if you're in a setting where protocols haven't been updated since the early 2000s, this is for you. You don't have to fight every tradition, you just need clarity, and that's what we're going to give today. In this video, we'll walk through what wet to dry dressings were originally for, why they keep getting used, what risks they pose that aren't always obvious, the wounds where they're absolutely not appropriate, and at the end, I'll give you the 3 simple alternatives you can suggest right now, even if you don't have fancy supplies. Let's go back a bit. Wet to dry dressings were designed for one job, mechanical debridement. You'd soak a piece of gauze in saline, pack it into a wound and let it dry, and then rip it out. The idea was you'd pull away dead tissue with the gauze. Sounds simple, right? But here's the thing. It doesn't just pull necrotic tissue, it pulls off the good stuff too, like pulling off a Band-Aid and taking healthy skin with it every single time. So why are they still around? Honestly, 3 reasons. They're cheap, they're easy to teach, and they're what we've always done. I've walked into facilities where the provider says, that's just our wound protocol, or a caregiver tells me, that's what the last doctor ordered. And it breaks my heart because most of the time, no one even reassesses it. Here's what wet to dry can do when it's misused. Pain. Pulling off dried gauze from fragile tissue isn't just uncomfortable, it's traumatic. Bleeding, especially in surgical wounds or granulating beds. Delayed healing. It rips out the epithelial cells, trying to close the wound. Maceration. If it stays too wet, it breaks down the surrounding skin. Infection risk. You're introducing a moist, often unprotected environment. Let me be clear, a wound that's healing should not be torn open every day in the name of cleaning. Let me tell you about Miss J. She was 84, bedbound, and had a sacral wound. Nothing fancy. Moderate drainage, granulating nicely, but her chart said wet to dry. The staff followed the order, ripped off that dry gauze twice a day. By the time I saw her, the wound had doubled in size. It wasn't infected, but it was raw, angry, and exhausted. We switched to a simple foam dressing, protected the edges, and within 3 weeks, it began to close. The wound didn't need a warrior, it needed a buffer. So let's make it clear. Say no to wet to dry if the wound is granulating, there's no clear necrotic tissue, the patient is in pain, you have to change it more than once daily, the dressing is tearing the wound open. Also, don't use it as default on surgical incisions. That tissue is trying to knit together. Don't rip the threads. Now let's be honest, wet to dry dressings didn't stick around this long by accident. They're easy to understand, readily available, inexpensive, and for a long time, they were the standard. So in some settings, especially when resources are tight or guidelines are out of date, it's not surprising to still see them when used. I'm not here to shame anyone who's used them. In fact, most people I've met who use wet to dry care deeply about their patients. They're trying to follow orders. They're doing what they were taught. The problem isn't bad intentions. It's that medicine evolves and wound care has moved on. Now, what can you do instead? Well, try one of these. Moist wound healing with plain hydrogel or saline gauze can keep the wound safe while cells do their work. Foam dressings can be used for moderate drainage. They're absorbent, protective, and easy to change. Enzymatic debridement like Santal targets dead tissue without harming the healthy ones. Even honey or hypochlorous acid can work in the right setting. And if you're unsure, keep it simple, keep it moist, and keep it protective. Here's a question I ask every time someone brings up wet to dry. What are we actually trying to do with this dressing? If the answer is, I don't know, it's time to pause. If the goal is healing, then our tool should help, not harm. And ripping healthy tissue out of the wound every day, that's not healing, that's re-injury. Remember that wound you walked in on, the one packed with wet gauze? Next time, don't look at the dressing. Ask, what does this wound actually need today? Not what it needed 10 years ago, not what was ordered and never reviewed, what it needs now. Because wounds aren't just skin deep, they're conversations, and wet to dry often shuts that conversation down. Thanks for watching. If this video helped you, check out my next video on pressure injury staging and how even experienced clinicians get it wrong. Stay informed and heal well.